Annual enrollment is now open for Medicare Advantage through December 7th.
It's a great opportunity for people to sign up for new health insurance benefits or make any necessary changes to their plans. But unfortunately, this is also the time when we see an uptick in health insurance scams. Joining us to continue the conversation is Shannon Drotning, the Market President of Consumer and Specialty with Providence Health. Thank you so much for being here with us.
Thanks for having me. Good morning.
It's very unfortunate that this is happening, but why do scammers target people during this time?
Yeah, I mean, this is the big open enrollment season, especially for Medicare, where people age 65 are with other conditions can change plans between October 15th and December 7th. So it's that short window where everybody's looking at plans, looking at their own plan, and they can be called by other companies looking to, potentially have a fraud scheme, which is unfortunate, right? The government will never call you, or somebody will never call you to ask you for your policy number or ask you what your Medicare card looks like. So I would definitely hang up, and it's just a ripe opportunity for people to try to switch plans or gain personal information because they're being called a lot.
Shannon, I hate to think that some of these people are being taken advantage of during this process. Who is most vulnerable for these types of scams?
Yeah, I would definitely say people on Medicare are most vulnerable for these types of scams. Especially during this open enrollment period, there's a lot of mail coming to, if all of you have a grandparent or a parent, you'll see a lot of mail comes to their house about Medicare open enrollment because all the insurance companies want to send out information and see if there's a better plan that you might want to switch to. But unfortunately, it's also a time where the phone is ringing and people think, oh, well, I received this piece of mail and now they're calling me. This must be real. And it's just so easy to tempt people to talk about those plans because when they call, they'll talk about, oh, there's a great dental benefit, or, oh, there's a great fitness benefit. And sometimes if it's too good to be true, then it is. And I'd recommend people just hang up the phone and call an expert. There's local health insurance agents. At Providence Health Plan, we live and work in our communities, so we can help as well. So it's really important if you feel there's something fishy to end the call.
What are some of the warning signs people need to look out for during annual enrollment? You said, if something feels fishy in the call, is there anything specific that scammers are doing?
Yeah, absolutely. So one thing to do is we all receive, when we go visit the doctor, we receive a piece of paper in the mail from our insurance company, and it says, oh, this is the doctor visit that you saw on this date and this how much it costs. I definitely encourage people to read those because if there's a scammer that has gotten a hold of your insurance information, then they could fraudulently bill a doctor for your services. So if you see something like that and you say, I didn't go to that doctor's office, then you'd want to call 1-800-MEDICARE right away and report that.
Let's think about the worst case scenario here. So what should somebody do if they, or maybe they have a loved one who's become a victim to one of these health insurance scams? What should they do in that circumstance?
Yeah, great. So definitely first thing to do, if you're on Medicare, call 1-800-MEDICARE. Also call your existing insurance company. So the company that you have, take a look at the number on the back of your card. Do that. If it involves your doctor's offices, call your doctor's office, let them know that you received a bill for something that you didn't go to. Also, a common scheme is to switch people's insurance companies. So if you're on the phone and they're selling you something, maybe a great dental benefit, and you say, yeah, I'm going to switch to that plan. And then you actually get on that plan January 1st and you realize your doctors aren't covered. That can happen too. So in that case, call 1-800-MEDICARE. They'll help you get back onto the plan that you were on prior.
Shannon, I'm thinking about those people that are going through this process for the very first time, and I'm sure, no doubt, are overwhelmed at just the influx of information that's coming in. What advice would you offer to those people that are starting that process for the first time about how to go about doing it?
Yeah, boy, it is so overwhelming. I've been working in this business for over 30 years, and I learn something new every day. Enlist help. Don't try to do it alone. It's very tempting we're also web savvy. It's very tempting to go on the web and say, oh, this plan looks good. It covers this. But really, there are so many nuances to a plan. Are your doctors on the plan? Are your specialists on your plan? Does it cover the prescription drugs that you need? Does it take care of the whole person and offering maybe dental benefits or fitness benefits? Talk to an expert, a local insurance agent, a friend or family member. The current plan that you're on, such as Providence Health Plan, we're here, we're in the community. We have local experts as well to help. But I just really tell people, don't go it alone.
Don't do it alone. All right. Thank you so much, Shannon, for joining us with all those helpful tips.
Thank you so much. Have a great day.
You too.
It is
Lots to sort through.
Yeah, there are lots of things to sort through, and it's a difficult time to be scammed as well. And so many of us are just trying to understand simply what our benefits mean, how to navigate Medicare and Medicaid, and then you have bad actors trying to mess it all up.
Yeah, and they go after a lot of times older folks who they see as being more vulnerable, or being more willing to pass along some of that personal information that can be used to take advantage of them, steal their money, steal their identity, that sort of thing. It's heartbreaking to think that that happens, especially when it's such a complex process, and some people, as we say, are going through it for the very first time.
Like she said, if something feels fishy, hang up. Yeah.